Hello, everyone. We are wearing green because it is St. Patty's Day, and you will probably see this at a later date, but hence green. But also, this is the color of mental health awareness, hence Dante's pin. Very good. So Alexa James with NAMI Chicago, happy to be back with all of you again. I feel like Dante with MyParachute, we could be like tag teaming and have like a road show going on now.
Yeah, I wouldn't mind that.
Yoga together, or
Yeah, absolutely. So
talk.
again, I'm Dante with MyParachute, and proud to be partnering with NAMI Chicago to run a campaign called Behind the Shield, which we're going to raise money to help anyone, and specifically the first responders with mental wellness needs. So just to say hi again.
Thanks, Dante. And Dante has brought Dr. Dantz with us today. Dantz, am I saying that correctly?
Yep, that's correct.
Okay, awesome. Who is faculty at Rush Medical Center in Chicago. We love Rush at NAMI Chicago. Rush is like such a dynamic healthcare system and does such incredible community work. And we are actually very proud, NAMI, is to be honoring Rush this year at our virtual gala that will be virtual and in person. So get your tickets. I know you will see our friend Dante there. And some other friends from Rush. So Doctor, share a little bit about the work you're doing and what brought you into the field of mental health.
Well, I'm a general psychiatrist. I have a private practice in downtown Chicago, and I also am director of medical student education and psychiatry at Rush. So half my time is spent teaching medical students about mental health and how to recognize and perhaps even initiate treatment in people who are suffering from emotional illness. To tell you how I got interested in mental health, well, that is a long story, but let's see, I'll give it to you because it's kind of interesting. When I was an undergraduate, I really didn't know what I wanted to do, so I went to the career counseling services at my college, and the career counselor said to me, you want to do something that you love so much, you just can't believe they'll pay you for it. And I was like, 20 years old. I was thinking, I would love like moving chairs or, furniture. I couldn't understand what that was. Anyway, I ended up getting a job after graduating on Wall Street and worked there for a few years, saved up some money, and then started traveling. And I traveled around the world for about a year and a half. And as I traveled, a lot of people speak English in other countries, and total strangers would confide in me these incredible stories about their lives. And I was just amazed that people were opening up to me. I had never met them before, and the stuff I was hearing was just mind-blowing. And I remember while traveling remembering what my career counselor said and thinking, wow, if I could somehow make a career out of this, that I would be something I would love so much. I couldn't believe they were paying me for. So I thought for a little while, maybe I would buy jewelry in Thailand and sell it in Japan, and that's the way I could make a living. But I always had this bug that I wanted to go to medical school. I wanted to learn medicine. So anyway, years later, I got into Stanford Medical School, and I went there and went through the various different rotations that medical student does. And then when I got into psychiatry, suddenly again, I was hearing people open up, telling me their stories, and I was just learning incredible things about them, their families, their cultures, and I stumbled about something that I just couldn't believe I could be paid for. In fact, every day is like being in the movies, but not just sitting back and watching, but in my field, I can jump into the movie and I can do something that can change the trajectory of the whole story. And really, I've discovered in this field that it's not just in other areas of medicine, we may just fix a broken leg or, treat someone's cold, but in psychiatry, it's transformative. We can by helping people who are suffering, it's not only giving somebody back a life that they had, but it's actually in a way transforming a life that a person never had. So I just serendipitously have landed in a field in which every day just brings me a lot of joy and satisfaction.
Wow, I think I need to use that quote. I don't know what your life I used to have or life I never had. That was pretty good. I think I'm going to use that. So thanks for sharing that, Dr. Dantz.
Yeah, that's a great story. And you know what? We talk a lot about actually, and obviously you hear this as well, is there's a dearth of psychiatry, of psychiatrists in Illinois, in the country, and why are people going into this field, and what are all the complications and the reimbursement rate, and you know, like all the politics around it, right? And why are we not having like sexy TV shows about psychiatrists and getting people excited about it? But I love so much that you found this field to be one of purpose because of the connections that you were making. And I think that's exactly what we miss oftentimes when we talk about mental health, which leads me to like, you know, very, I think, easily into the next question, which is, what do people need to live the life that they can live or that they could live? What does recovery require in your perspective?
Well, I think we're all hampered by this kind of nonstop chatter in our brains that can either bring up depressing thoughts, anxious thoughts, delusional thoughts, all kinds of thoughts and feelings and overwhelming feelings that can really interfere with being in the present and attending to the task at hand. And so what we really need is ways to deal with the cognitions that are interfering and the overwhelming bodily, physical reactions that might be interfering, and kind of the overwhelming emotions that can be stymieing us from fulfilling our goals.
Absolutely. Dr. Dantz, I was just kind of thinking, as we turn on the TV and we're looking in the news, mental health seems to be at the forefront of what's going on kind of in the pandemic. What are you seeing? And kind of following up on that, what are some, you know, if I'm watching this, what can someone do to go and seek help? Or what does that mean in your mind?
Okay, well, those are two questions. The first one about what we're seeing in COVID is a surge in demand for mental health services. I mean, there is loneliness and isolation are driving people literally crazy. This is just a very, very tough time. To be denied the ability to see one's family members, one's friends, and to be stuck in a bubble of maybe one or two people or no person or nobody at all is very taxing. I mean, we all need social interaction for a healthy internal world. And so COVID is really taxing us in terms of isolation. And then you get the people who are out of work or are not able to find work, and that's imposing additional stress and burden. Then you have the effects of the illness itself. About a third of my patients have actually developed COVID over the last year. And fortunately for most of them, it's just been an illness like the flu that they've contracted, and then they've gotten over it and they've been fine. For some people, though, they actually present with severe psychiatric symptoms: insomnia, the inability to sleep for days on end, severe anxiety. There are people who have become manic, delusional, have to be hospitalized as a result of acute infection with this virus. It affects the brain, it attacks the brain. And then you have people who, even after the acute infection is gone, are dealing now with these prolonged symptoms of fatigue, headaches, shortness of breath, sleep disruption. And they're waiting for this to go away. And it's a month, 2 months, 3 months, and it's not getting any better. And so there's yet another source of just profound emotional suffering when dealing with these physical symptoms that are just not going away. So as a result, there is tremendous demand for my services and my colleagues. I mean, it's it's hard now to even find a mental health professional who's available because the need has been so great. And as you indicated earlier, I mean, the supply of therapists and psychiatrists is not high enough to meet the demand. Now, the next question you had is what to do if you are suffering, right? Mm-hmm. And you've never sought mental health right. professionals out before. What are you going to do? First thing to do is to talk to someone you trust. Talk to someone whom you can confide in. Chances are that other person you talk to, he or she has had some contact with and either knows somebody who's had mental health treatment or has had mental health treatment himself or herself. And that person can help guide you, can refer you to somebody that they know who can then actually help you. Another thing you can do if you have a job, all companies in the human resource department have employee assistance programs that are confidential. You should make use of that and call the employee assistance programs and ask them for help. And finally, if it's getting to the point where you're having serious suicidal thoughts or feeling that you're going to hurt yourself, hurt someone else, or you're hearing voices, or you're feeling like you're in some danger from someone else, you can go to the emergency room. And that's the fastest track towards getting help.
I would also add, thank you so much, Doctor. I'd also add that the NAMI Chicago helpline is free. It's 7 days a week. It's confidential. It's 833 NAMI Shine. We can manage.
There's also a suicide hotline as well.
Mm-hmm. Yep.
Absolutely.
So you mentioned that it's very difficult to get in to see a provider because the need is so great. Now, the need was so great before COVID as well, right? I don't think that people were as engaged in seeking services, that there was still a tremendous amount of stigma and barrier. What about COVID-19 do you think has increased people's help seeking behaviors?
Desperation. I don't think the stigma has necessarily gone down, but you can't cover it up anymore. You can't cover up your suffering socially. There are people that have been working on their anxiety by going to the gym every day. Then when fitness centers closed, what would you do, right?
Right.
So one thing that's happened with COVID-19 is like the lack of the ability to talk to friends or to see friends has increased desperation, the loneliness, and then the lack of activities that you could use to distract yourself, to make yourself feel better, have been gone. So indeed, it's desperation more than anything, more than a reduction in stigma that has led to the increase in number of people seeking help.
Yeah, the gym thing is huge. We often don't integrate physical and emotional health, and part of what MyParachute is supporting, what we are doing together in this effort is making sure that people have access to movement and to breath and to the enhancements of physical health, particularly for those working in a more untraditional non-traditional, like work hours, when do they get to go to the gym? Are their gyms open? Et cetera. So that's been encouraging to see how that can also feel less intimidating for some individuals to do some breath work or physical movement versus talk therapy, which can feel super intense for folks, particularly with high levels of trauma.
Yeah. You were talking about a gym. I'm sitting next to a new treadmill and weights behind me too. So that's not for me. I kind of look at it, hang clothes on it, but I think we're reinventing ways to be active. And I appreciate your answer, Dr. Dantz, with that. Just kind of looking at the stigma around seeing somebody, if somebody's like, well, I got to go sit and I'm probably going to have to, share my feelings, or they just feel uncomfortable. What would you tell somebody that's kind of hesitant about seeking help? Some of the myths and some of the facts about actually recovering and what you see with your patients.
The most important thing is to make it clear that mental illness is no different than physical illness. That if you were having disabling headaches or persistent diarrhea, or you were having, you tore a muscle in your leg, you would go to someone who's a professional and talk about it and seek help. The brain is an organ just like the heart. It can go awry. And so there really, we know a lot scientifically right now to know that mental illness is a biological illness. It's really, we have the phrase, it's a biopsychosocial illness, but so is diabetes, so is heart disease. But the important thing is, this is not your fault. This is an illness, and really got to think about it like you would any other illness. And when you can look at it that way, it's not such a big deal to reach out. And the person that you're going to go to see is a professional who does this all day. They're not going to look at you any differently than they look at anybody else.
Yeah, no, thanks for that answer. I think that, the big point is, if somebody can't feel like they want to do anything and they say, well, go take a run, would you tell that person to take a run if their leg was broken? Someone told me that one time and I was like, probably not, so I think that was a good point that you made. So thank you.
Thank you so much. Like, useful information. I'm thinking about it. It's always, my day is filled with conversations around mental health and wellness and system reform. But it's always so wonderful to be introduced to a new ally and hear about their perspective in the workforce. And of course, being with Dante is always enlightening. Do you feel, I'd love to kind of start closing up our conversation with the question of, Doctor, starting with you and then Dante, do you feel hopeful about the way that mental health care will be viewed in all systems? And do you feel hopeful that the capacity for being able to provide more people higher quality services will occur due to COVID, due to whatever, right?
Was a huge transformation in my field as a result of COVID. And that is, people are now meeting with me online via Zoom, FaceTime, or any other of a dozen different types of video platforms, and where they don't need to actually drive somewhere, park somewhere, or take huge amounts of time out of their day to actually reach me and get help. And I kind of will mourn the loss of seeing people in person. I think there are some tremendous benefits to patients when you have to take time to go see your therapist and think about, well, what's happened in the last week? How am I doing? What am I going to talk about? And then when you leave the therapist and you're on your way and you start thinking about what you talked about, now it's like you're doing your work. Oh, it's time to talk to my doctor. You get online, you talk, it's done. You go back to what you're doing. I don't think there's as much time for reflection. That's the downside. But the positive side is it's going to be expected that most mental health professionals will provide online video services, and therefore it will be a lot more convenient for people, especially people with whom, time is money and taking time off work might have been very difficult. Well, if it's done via video, you don't have to worry about all that commuting time. So I think it is going to be more accessible, especially people who live in rural areas, or suburban areas where there's lower number of mental health professionals. They'll be able to access via video relatively easily. So I think that's going to be a positive development in terms of access. I do also believe the stigma is going to go down and is coming down with COVID, just because the recognition that so many people are suffering. So I think that is going to be a benefit from COVID, is that it is going to lower this, it'll just knock it down slightly as well. In terms of the supply of clinicians, I don't see that going up. I know that in my field, the number of medical students applying to psychiatry has doubled over the last 5 years. However, the number of residency spots has not gone up. And in fact, we are now in a situation where students who want to go into psychiatry are being rejected and they can't even get into a residency program. So the things are going to have to change there. We need a much larger supply of professionals at all levels to meet the demand. And of course, since insurance company pays so little for psychiatric services, 50% of psychiatrists do not accept insurance, because that would be who would voluntarily cut their salaries in half in order to take insurance. It doesn't make sense unless you're independently wealthy. So there needs to be some solution to the insurance problem, and I don't know what that solution is, but the major obstacle for people getting psychiatric help from a medical doctor is the expense, because it's very hard to find a psychiatrist that accepts insurance.
Right. And even if they do, the wait time is so long. Well, I will tell you, doctor, that my team, my policy team, along with our kind of cohort and coalition of amazing advocates, have been doing work around mental health parity, as well as Medicaid reform and reimbursement. There's often, as you know this, that often if someone is living with serious mental illness, they're typically leaving the commercial insurance world and going into Medicaid because they have more access to services, and that's not in line with parity. So there's been a lot of work through Thresholds and Healthy Minds, Healthy Lives Coalition, and to try to reform that. So we're excited about some legislation that will hopefully also legitimize this work. I mean, if I had a heart attack and I had no insurance and I walked into, Stroger Hospital and I needed open heart surgery, emergency surgery, it would happen, and there'd be no pre-cert and no, or do we have a bed? And so that to us is a huge issue, of course, of equity and really healthcare justice, and something that we're working on. So I loved your answers, and I love what you said about the reflection, because this is something that's coming up for us in the workplace. I'm trying to make my staff, for example, put 15 minutes between their Zooms, because nobody's having time to actually sit with the information or the thought partnership, because we have no commute time, we're taking advantage of that, but it's also causing a whole lot of issues. And I never thought about that from the telehealth perspective. So that's really interesting and makes total sense. So thank you for that. Dante, what are you hopeful about in terms of mental health, mental wellness?
Well, I was thinking about that. I think 3 years ago, MyParachute wasn't in existence. And then with the help of NAMI and Dr. Dantz today, if someone's watching this and we can help them, it's great. The conversations amongst myself, even my peers, have increased tremendously just by getting involved with MyParachute. And I think as we go forward and this gets out there and the message spreads, people are going to feel more comfortable coming and sharing their own story. I think it's great that Dr. Dan suggested just find someone that you trust or that you can open up to. And people are surprised how many others suffer from the same thing, and that you're not alone. This is, 1 in 5 people suffer from a mental illness, and unfortunately with what's going on, it's on the rise. So the more that we can talk about that, spread the word, raise funds to help NAMI, we're headed on the right path. And I will say, as we talk about teletherapy at myparachute.org, you can link up to Talkspace, which is another way to outreach and find therapists and medical professionals. And I think that's important to understand too. Dr. Dantz, I know you do both. You do medicine and you do therapy, but there are people out there that will just do therapy. And if you need it, they will suggest someone that can prescribe medication as well. So I'm very hopeful. I hope that these continue. Dr. Dantz, all your answers were very enlightening, and I think people watching this will definitely learn something. And like I said, if it could help just one person, it's worth it. So
thanks, Dante. Yeah, I'll answer my own question because of course, I am hopeful about a lot of things. But I think I finally understand this cliche rhetoric of you are not alone, which most of the time offends me, because I know as somebody who's experienced depression and isolation and significant life transition, it doesn't matter if you're surrounded in a group of people, you feel alone and you feel lonely, because nobody knows what it feels like for you as you're smiling and negotiating the world, right? And what I understand it to me now is, if we can remove this social norm that we think is so polite, and actually talk about how we're sharing this lived experience, that's the connection piece that makes us feel connected and community, right? And that there's community healing. That's the I don't feel so alone part, because I don't want anybody next to me suffering how I do, or my peers or my community, right? But at least somebody knows this feeling in me. And that also allows other people to show empathy, which I think is a very scary place to be, that vulnerability. So I'm hopeful because I'm hopeful because my children didn't ruin our conversation. And I'm hopeful that, folks will start to feel much more comfortable will continue to talk about their wellness the same way we talk about headaches and back pain and sleep issues and all of those things, and that there's a very significant community at Rush, with MyParachute, with our friends and family, with NAMI Chicago, people who are there to hold you when things feel unmanageable, and before they feel unmanageable, find your resource, because it's much easier to know what to do and to have some preventative practices than when it's hard to get out of bed in the morning to start negotiating that process. So
one other overlooked psychological pandemic that is going to come after this pandemic is over is actually that of pets. And I don't see people talking much about what's happening to pets, but they have become accustomed, especially dogs, to having their owners, present all the time. And when people start leaving home to go back to work, it's not going to be business as usual for the dogs and cats that you're leaving behind. And I'm frankly I've been seeing with my own patients that their dogs, when they're on video with me, they're just not leaving them alone. They're glued to them. My patients are telling me they can't even go to the grocery store without the dog howling. And I think people need to also anticipate when they start going back out to the real world, what are they going to be doing with their pets? I'm really worried about that aspect of this as well.
Got our furry friends. It's a really
Yeah.
good point. Yeah, there's a lot that we're going to have to consider as we transition back. And I think that we need to pay a lot of attention to all of that. So Dr. Dantz, I hope you continue to engage with both of our organizations and enlighten us and share wonderful feedback. So thank you so much for joining us on this.
Thank you for inviting me.
Of course, and Dante, thank you for organizing and
no problem.
facilitating a lovely conversation, for all of your support as always.
You're welcome. Thank you.
Okay,
Take good care.
bye-bye.
Bye.
Thanks, guys.